and tertiary, and so on and so forth. Okay, and the right lung is got the superior lobe, middle lobe, and inferior lobes. It's got 3 lobes, and the left lung only has 2 lobes. Okay, so if you look on, let's say in the future, a patient has pneumonia, and one will be on the X-ray, it will show up as white. Okay, because it's filled with fluid, and you can tell how many lobes or how big it is and where it is located, and you can tell which lobe is affected with pneumonia and all that stuff. And if you remember, it is got a covering, a serous membrane. Okay. Blood and nerve. Pulmonary circulation is devoted to delivering the oxygenated blood to the lung. If you remember the circulation of the heart, okay, the artery, okay, is the one that carries the deoxygenated blood, okay, to the lung. And then the vein is the one that carries the oxygenated blood. Okay. So the oxygenated blood will return to the heart. So the autonomic nervous system controls the flow and reflex. Bronchial restriction is through the parasympathetic. Dilation is through sympathetic. Oh, here it is. Here's that pleural. The serous membrane we talked about earlier, okay, the visceral pleura and the parietal pleura, which is connected to the wall. The visceral one is connected to the lung itself. The fluid, again, is to reduce friction. So, inspiration is inhaling, expiration is exhale. Okay, there is a pressure and volume change, and we're going to go through them. Okay. Major mechanism, so atmospheric pressure. So as you know, the atmosphere has something called the atmospheric pressure. Okay, is always pressing down on you. Okay, that's why when a fish comes out of the water, okay, they can't breathe because there's a pressure pushing down on their gills, and they can't breathe. Okay, but we're used to the weight of the atmosphere. Okay. So it will be abbreviated as partial pressure of the atmosphere. Air within the alveoli is partial pressure of the alveoli, and pressure within the pleural cavity is denoted as this. Okay. So here it is. Pressure. Okay. When you exert pressure into the lungs, okay, as the volume increase, okay, like this, the pressure will decrease. And if you press down on something, okay, the pressure will increase. But at the same time, the volume is smaller. Okay, so it's inverse. Okay. Pressure comes from the movement of molecule. Okay. The less space, so here, the less space, the more pressure. So to create a difference in volume, you just need to change the volume. Okay, so this thing is called a Boyle's law. Okay, of course you don't have to memorize this formula. Just know the increase of space, decrease of pressure, and increase of pressure, there's less space. So here is how we breathe. The atmospheric pressure due to the weight of the air is not going to change. Okay. Intra-alveolar pressure. So where is that at? Pressure of the air in the alveoli itself. Okay, so in the alveoli, there's pressure. Okay. There's also intrapleural pressure, which is right here, intrapleural pressure. It's the air within the cavity, also change in the phase of the breathing, but always less than the pressure of the alveoli. Okay, so the intrapleural pressure is always less. So we call this negative pressure, okay? It's always less, okay? So when something has a less pressure, it's always going to be sucking, like, okay? That's how the lungs can maintain its shape, okay? Because of this intrapleural pressure, it's always causing a negative pressure right here, so it keeps the shape of the lung, okay? Intrapleural pressure. So besides pressure, what else do we see? We see the contraction of the diaphragm and the thoracic muscle, which cause the pressure change. So, you all know the diaphragm's down here, okay? When the diaphragm pulls downward like this, okay, it causes a pressure change here, causing air to be sucked in here, okay, or the muscles around. Resistance, okay, slows the flow. We know what resistance is when something's trying to push you or something, okay. Surfactant tension in the alveoli inhibit expansion. Surfactant decreases surface tension. Compliance is the ability to stretch. Okay, so anything that's compliance is about how far things can stretch. Okay, you remember when we talked about in the heart, okay, it is one of the factors is the compliance. So pulmonary ventilation. So all these are just terms, okay? How do you actually breathe? So air will flow from high pressure to low pressure, okay? When you breathe in, inspiration, okay, atmospheric pressure is greater than the intra-alveoli, which is greater than the intrapleural. Now remember, the intrapleural is always negative, okay, always the least, okay? So atmospheric pressure is stronger. That's why it's able to come in here, okay? And then this is that pleural pressure that keeps sucking the lungs, okay? It's like when you blow something in a balloon, okay? Inside the balloon will have a lot of pressure. Once you let go of that balloon, everything will go out, okay? But when you're blowing, as you're blowing in there, the pressure from the outside is stronger than the inside, so it's going to push in. So that's all it means, okay? Expiration, flowing out of the air, okay? Because the intra-alveolar pressure now is greater than the atmosphere, okay? That's how air is exchanged, okay? Some of the muscle that makes it happen with normal inspiration, when you breathe in, the diaphragm will pull, okay? And there is external intercostal muscles, external intercostal muscle, both expansion or increased size of the thoracic cavity. So they'll make the thoracic cavity bigger. Due to the adhesion force of the pleural fluid, again, that is the negative fluid right here, the adhesion of the pleural fluid, okay, the expansion of the cavity forces the lung to stretch and expand, okay, so the lungs are kind of stuck kind of to the outside of the thoracic cavity. So when it comes in, okay, when you breathe in, it stays there. When you breathe out, it also stays there. This increase in volume will decrease the intraocular pressure and the air rushes out. So when you breathe in, okay, the atmospheric pressure is stronger, but when the diaphragm relaxes, then the alveoli pressure will be stronger and it will push the air out. It's not because the diaphragm is pushing. Diaphragm just relaxes, okay? And then it just relaxes, causing it to, like that jar we saw earlier, causing the pressure to increase here, and it will force the air out. One more thing to remember when you breathe out, decrease volume. Okay, what decreases in volume? Okay, when you breathe out, okay, this volume is less because of that pressure. Okay, and the pressure increases in the alveoli, and then you breathe out. Now remember, expiration is passive. Okay, there's no muscle contraction. The diaphragm just relax, the external intercostal just relax, and then when you relaxes, everything is pushing. Okay, when everything is pushing toward the lungs and the alveoli, then the pressure increase, then it will cause you to blow out. The factor responsible for normal expiration, elastic recoil of the lung tissue and surface tension. Okay. The factor that increase the intra-alveoli pressure, it is the atmospheric pressure forcing the air out of the lung. Forced breathing. When you exercise and you need more air, okay, you will have then forced inspiration. You're going to need to breathe more, okay? That's why when you breathe more, you're going to recruit other muscles, okay? Involve some of these includes the scalene, the SCM, if you remember, okay, and the pec minor, okay? Remember these muscles. Forced expiration, if you breathe out and force the rest of the air out, you're going to need internal intercostal and the abdominal wall muscle. Okay, again, remember them. And remember the external intercostal is for normal breathing. Okay, we're going to look at this chart, and we need to know it well. Okay, so, and these are different terms you need to know. Okay, so this is how the whole thing is called the total lung capacity. Okay, how much your lungs can hold. Okay, vital capacity